One of my patients nearly died from an amniotic embolism while she was in labor. It's so rare that the only way to diagnose it is by ruling pretty much everything else out first. It's essentially when the amniotic fluid accidentally passes into the mom's bloodstream as he or she had a cardiac arrest, and we did CPR while doing an emergency C-section. She is slowly recovering, but has lost most of her brain function. My mother, now retired, was a GP in the middle of nowhere, in southwest France. In the early 90s, she had her first HIV cases with the med at the time. They did not last long, except one, clearly HIV, but not developing AIDS at all. He was one of the few people with natural immunity. Had a very sick child with influenza. Spent 6 months in my ICU. Had a month of blood gases that were not compatible with life. Had multiple collapsed lungs. He's currently in 6th grade, no ventilator, no tracheostomy, literally no complications for the long term this year. Inserted a urinary catheter to a female patient. She complains of pain where the bladder is situated, and it was distended, no drainage per catheter. When we pulled the catheter out, there it was, a worm which got stuck inside the tube. How the hell did the worm enter the bladder? I'm not a doctor but an RN. Before I was an RN, I was a patient care technician in the emergency department. I often worked closely with a specific doctor. She had a habit of thinking that there was always more to symptoms than there were. So no one ever took her seriously when she went digging. She especially paid close attention to pediatric patients, and ordered way more tests than any of the other physicians would have. There was a 12-year-old boy whose parents brought him in for suicidal and homicidal ideation. The child talked about how he hated himself, wanted to die, suddenly hated his parents and siblings, and often thought of hurting things or he had no history before this of being mentally ill, and it happened very suddenly. Within a week his personality changed. His parents were absolutely certain that it was just him being a preteen. Hormonal and unstable. All the things he described were typical of a depressed and mentally disturbed preteen, and none of us thought anything otherwise. We assumed he was suffering from mental illness. However, when the doctor spoke to him, he vaguely mentioned having frequent headaches and getting dizzy a lot. He and his parents also talked about how he had started complaining of nausea and would sometimes vomit for no apparent reason. She thought that he may have something organic and not just mental going on. She got a CT on his brain. I remember the nurses saying she was overreacting and that the kid should just have a psych consult and be hospitalized. I very distinctly remember people complaining about doing more work than necessary on this child, who was obviously just mentally disturbed. It turns out, the kid actually had an atypical teratoid rhabdoid tumor, ATRT, which is incredibly rare, less than 1% of childhood brain tumors. The tumor had been there long enough to spread to his frontal lobe. On further questioning after he was diagnosed with the ATRT, the child had been complaining of dizziness, vomiting and headaches long before the personality changes, but it was attributed to him being overweight and having ADHD. It's honestly amazing that the child lived long enough with this tumor for it to spread so far, as it's such an aggressive tumor, and generally, children don't live long with them, especially if they're growing at that rate. It's a rare brain tumor, and even more rare that a patient lives long enough for it to spread and cause personality changes. I will never forget that a doctor always looked further into things than people thought necessary. If any other doctor had been on that day, the kid would have been referred to psych, hospitalized in a psych institute, and dead in weeks without his parents knowing it was all due to a tumor until after an autopsy. After a neuro consult, he was shipped to Boston's Children for his brain surgery, one of the top places in the U.S. for pediatric neurosurgeries. And he is alive to this day. He has to have therapies to help him learn how to live normally again. But if it weren't for that specific doctor being on, he'd be dead right now. Eventually, he will live a normal and long, healthy life. That really taught me to respect a doctor's knowledge more, especially if it seems like their intentions are good. Trust the physicians you work with and trust that they are ordering those extra tests not just to save their own asses, but because they want to save lives and are concerned about their patients. Story from last year. After a pretty uneventful pregnancy, a woman goes into labor, but it doesn't advance as quickly as it should, so she gets a secondary cesarean section. Standard procedure. The baby gets out and its eyeball is almost pressed out of the eye socket. Everybody is in shock. The parents start crying. We don't know what to do. Turns out the child had a huge tumor of the temporal lobe which pushed the eye out. We later analyzed the ultrasound pics and the tumor was already there, so it just got overlooked. Brain tumors in neonates are even rarer than 1 in a million. It's actually 0.3 per million, so I hope I'll never see such a case again. Edit. Unfortunately, I don't know the outcome. The child was transferred to another hospital. Had a patient come in with headaches and she was a young woman. Her entire body would go numb with these headaches. Got a CT. She has 3 separate tumors in her brain. I was a paramedic and I came to a scene where I had a patient who was talking to me. But he had no blood pressure and no detectable pulse. I couldn't even hear his heartbeat with a high-quality stethoscope. They dumped a few bags of fluid in him in the eye before they were barely able to get a BP on him. Is here. I'm not a doctor but a patient. I was born with a large vascular tumor in my right thigh around my right hip that caused my right femur to gradually die. But my case wasn't 1 in a million, but 1 in 7 billion. Why? Being born with a tumor is very rare. About 0.3 in a million. Plus it was vascular. It was very large at approximately 18 by 11 by 15 centimeters. About 7.5 by 4.5 by 6 inches. And contained more than half my blood volume. Despite its size, it was not visible. There were no bulges or discoloration or visible signs. This means it was embedded and striated in my muscles, and caused many lifetimes worth of physical pain. Fast forward to when I was 20 when they discovered I have osteonecrosis of my right femur. Essentially, the blood supply to my femur got cut off and the bone started to die. I saw literally more than 100 doctors and no one could figure out why I have it. Why at such a young age. And what they didn't understand was this never-before-seen comorbidity. No scientific literature on cases remotely like mine. My case was discussed by doctors worldwide and it was confirmed to be the first case in the world. In order to even begin treating the bone, I had to have my tumor removed. I was scheduled for a surgery in mid-2017. Was told it was just going to be a 5H surgery and that I'll be free from the tumor after this. They told me with any surgery some bleeding is expected, which is frankly common sense, but that I didn't have to worry about it because they ran thorough blood tests on me and I showed no abnormalities in the blood. I woke up 4H later and the surgeon told me they were not able to remove the tumor. What happened was, after they cut me open and before they got anywhere close to my tumor, I started hemorrhaging and lost more than half my blood volume instantaneously. I just wouldn't clot at all and they didn't know why. Went into shock and I almost died. At the age of 21. Later I saw a hematologist to figure out what went wrong and she told me in her 30-year career, she's never seen a vascular tumor like this. And such weird bleeding. She had to order a rare blood test, and it was determined that I have an extremely rare blood disorder found only in vascular tumors. Somehow the blood in my tumor spontaneously formed many clots on a daily basis, and I ran out of clotting factors and platelets. Because of how isolated the tumor was, they couldn't detect this abnormality with blood samples of blood flowing in my bloodstream this year. I continued to deteriorate and there was no way to fix me. In January 2018, less than 2 weeks after my 22nd birthday, I was told I was dying and had at most only 1 year to live. I had two options. One is to be content with the time I have left and do nothing, or risk everything entirely to go for a surgery ASAP, but it has a 90% mortality rate. Normally doctors won't operate if they know the patient might die, but in my case not operating will kill me. They had to take any chances of survival, no matter how slim, as your got booked in for a surgery to try to remove the tumor. The nature of the surgery was the first of its kind, the first in Australia, with more than 20 surgeons involved worldwide. I was in there for 12 hours and in a coma in the ICU for 5 days. 2 muscles and 70% of the tumor was removed, and now I have a huge dent in my right thigh. Permanent nerve damage. I don't feel a thing. Despite everything, my doctor said that it's a miracle I'm alive. There are some after effects though. I suffer from severe PTSD, depression and anxiety, on top of my severe chronic pain. I have one last surgery for now, which is a total hip replacement. A common surgery, but not at the age of 23, but with extra details like removing my dead femur and dealing with my rare bleeding disorder. However, due to the complexity of the case, my bleeding issues, in that the remaining 30% of the tumor that they were unable to remove is the same part of the tumor that almost killed me. It's a tad bit different, and I'll have more than 5 surgeons involved in the upcoming surgery. Wish me luck. Edit. Measurement in inches. Edit. Thank you so much for your wishes. I'll continue to fight and I'm a nurse, and this happened at the hospital I work at. In the car park, a staff member got out his car and it started rolling. He reached in to pull the handbrake. From where I was sitting in my car, I didn't notice anything other than the car moved, and the guy jumped back in his car. A few minutes later, a lady walks by and starts screaming. Turns out he had been pinned half inside his car by his car door. As his car had rolled towards the car next to him, he was unconscious. Blue. Not breathing. A bunch of us tried breaking into the car next to him to move it. And eventually, when there was about 20 of us, we actually managed to push his car back enough for PPL to pull him out. Luckily, this happened at a hospital, so the crash team had already been called. They did CPR. He lived.